In terms of the right to a name and identity, 2 years ago we entered into a partnership with the European Union to make sure that the government of Mozambique can move from a manual birth registration system, which is very outdated and very archaic, to an electronic civil registry with a link to vital statistics. So the EU funding has helped us hire expertise that helps design the software for the government to have an electronic database on births, deaths, marriages and divorces with a link to adoption. And they designed the system based upon a study visit that they did in Uganda. They imported the software, customized it to the Mozambican context, and now have designed SMS technology for chiefs and citizens to notify births and deaths by SMS, directly calling into a call center. And today we are at the call center, at the Conservatory of Car Marks in Maputo, which will be the first one of its kind in the country, set up with EU funding in terms of the technology that they have invested in it, in order to make sure that the system becomes totally modernized for people to notify, call in about births and deaths, then receive a personnel number from the call center, which they can use later on to come and collect a printed birth certificate. Now, the electronification and the informatization of the system will allow for the analysis of data on a monthly basis with a link to vital statistics with the National Bureau of Statistics, so that the country starts to know the moment that the system has been rolled out over time how many children have been born, in which province, what's the population density, and how many people are dying and the causes of death as well. So we are very thrilled to be part of this partnership with the EU, which is becoming expanded with other development partners as well. The government has developed a comprehensive costed operational plan for $40 million to roll out this electronic civil registry system across all the conservatories in the country, which are 156 at decentralized levels. And we are very pleased to move to technology for development to enhance service to the citizens, which starts with the right to a name and identity.
So behind me you can see work going on in what will be the data centre for the call centre, where all the servers will be stored. There's a lot of wiring to be done, and this is going to be launched in just 2 weeks' time.
My name is Esperança Nyangumbi. I'm head of the call center. This one is the main call center in the first conservatory in Maputo province. This will be the first electronic call center, and we have got something like 40 people working here doing birth and death registration. Per day we have got something like 40 or 50 birth registration per day. This one is the first call center electronic, and the first conservatory will be the main call center. The purpose is to all conservatories of the Mozambique will be in the electronic system, and they will send all information for this call center.
Here we have the web page of this CRVS system. We can fill in the forms for the registration process. Just clicking here. This is where we fill in the username and password for someone to begin the registration process. So it will open the forms we fill in, and then after filling the forms, the process goes on, like printing the certificate, birth certificate, death certificate, and you have also here statistics. We can see here some information about this CRVS.
Here in Nakalapoto, it's been seen that the main motivation that's up and coming now for birth registration specifically is with regards to the up and coming industry. As we can see, there's a big contrast between the rural area that's still prevalent for a lot of people, but also now that the emergency industries are coming with regards to this being the new main port for Mozambique, and that will have an international airstrip. There's a lot of employment opportunities for the people, and also they're becoming aware that their children need to study.
So we're here at the birth registration office in the port north of Nampala, where registrations are still done manually. And here we've got a birth registration underway.
People come to register his parents. It's about the industry. The problem is Nakala, a lot of strangers invest, and then the request for documents. And then the people doesn't have this document. The motivation, this is some motivation to come to the register to ask for these documents, certificate for the birth. The problem is the people waiting for the ancestral. Then if they don't receive the name, it doesn't come. And we must do a lot of job to change this idea for the people.
Okay, so here in Nakalapoto, this is one of the National Health Week posts. Currently, there are 12 running. So on that side, the children get immunization and vitamin A administered to them. After they have been vaccinated, that's when they come here to this side for the free birth registration to occur. The birth registration is the age limit of this activity is from 0 to 5 years. So only children within that age range are being attended to. As you can see, there's still lots of children to be registered due to the queue that they've improvised. So they don't have to stand in a queue. They've put in their health cards or their slippers to show their place in the queue.
And here they're giving the children vitamin A and immunisations prior to having their births registered. And this is the actual registration point with the registrar doing all the birth registrations. Very patient queues of mothers and children.
So as one of the mothers just told me, she's been here since 5 o'clock in the morning, but she's still at the back of the queue for the registration. And she says that the others that are in front have been here since 3 in the morning. And when I asked why, she says that it's because they want to make sure that children have access to education and have an identity. So they'll stay here until they have their birth certificates.
So we're at a school in Rabawe in northern Mozambique, and they're using the school as a post for conducting birth registrations. And basically they've done a really good catch-up job. So a lot of the people here have now had their births registered, the older children. So what you're finding is it's only the ones and under that are now left that have been born since the last big campaign. So the room's really full of little babies waiting to have their births registered, as we'll see. So we're here at UNICEF in Nigeria looking at the progress of birth registration in the last 2 years as a result of this EU-UNICEF project. Nigeria's got a really booming population, so 181 million people currently, and it's estimated that by the year 2050, Nigeria will be responsible for 1/10 of the world's births. So it's really vital that the civil registration infrastructure is really strong and in place in this country, not just to benefit the children of today, but to build capacity for future generations in both protecting their rights and also at the level of planning, good governance, knowing how big the population is and what their needs are.
Starting from October 2013, UNICEF supported National Population Commission to bring together broad stakeholders that will be looking at sustaining the National Plan of Action for CRVS in Nigeria. This includes the National Identity Card Management Office, the Immigration Office. There's been a lot of work with the religious and traditional institutions, the civil society organizations, and broad actors of those that are in the pipeline of ensuring a wider coverage of birth registration, particularly that will feed it into the CRVS systems that is being built in Nigeria.
Until when I came to Abuja here, I took my child to school, private school, for enrollment. They insisted that I must bring birth certificate from NPOC. It took me like 10 minutes to get this birth certificate from them at no cost. So that very day I returned back and he got enrollment.
Nigeria, as a developing country, needs a very comprehensive system of civil registration system on ground, as most of the vital statistics generated must come from those effective, a very good civil registration system. And this, we know, we cannot have important statistics like, calculating infant mortality rate or maternal mortality rate, which are very key. The level of so many indices that are required for development purposes, which cannot be obtained unless we have a very good civil registration system on ground that generates vital statistics that can be used for development purposes.
Okay, the local government councils issues birth certificates and they charge revenue. They issue birth certificate to generate revenue. They don't generate any demographic data out of it. We issue birth certificate free of charge and we generate data, demographic data. Meanwhile, initially they saw us as a threat because they are losing their revenue since we are giving it out free. But over time now, they have come to realize that the data will return back to them for planning is more cost effective compared to the revenue they are losing.
The UNICEF. Of course, we all know that this day itself is also a day being projected by United Nations.
But we all know, and I don't want to go back to all that I've been told. I'll just ask you a few questions. How many of us have a birth certificate from National Population Commission? How many of us from National Population Commission? If you have, let me see your hand. So the one you have is different. You don't even know. Will you do that as an homework and ask your mommy that mommy is my birth registered with who? And then the national population, we're going to come to your school and register your birth. Learn to speak out. Thank you very much for listening.
Thank you for her. Give her a round of applause.
It's 25 minutes to the top of the hour, and we are still talking about children's rights right here on 95.1 Nigeria Info. Sharon Oladiji is our guest, the Child Protection Specialist with UNICEF Nigeria. Now, if you want to be part of this conversation, go ahead and send a text.
And some of the problems we have, for example, is also health planning. I'll give you an example. The graduates, 21 years old, 22 years old, were born 22 years ago.
Yeah.
So right now we have a lot of people who are doing research, thousands and millions. They were born 22 years ago. We ought to have known that 22 years down the line, this million young people will be ready for work. They should be ready to go into the society. They should have means of livelihood. They should have jobs to do. They should have all that.
So we should plan ahead.
So we should plan ahead. But if we do not know the number of children that are born today, how are we going to plan 10 years down the line, 20 years down the line? And that's part of the problem we're having. And can I quickly tell you about Rapid SMS Nigeria if you're listening to me? If you Google Rapid SMS Nigeria, if you open it, it will ask you about the dashboard. If you click the dashboard, Nigeria dashboard, it will show you, it will take you to a platform. It will show you things about MNCH, Vedness, click birth registration. And that is something, plus a database. If you say there's no data, there's a lot of things being done in showing or showcasing the number of children that are registered part-time per day. So if you click on, you see cumulative if you want, you see month if you want, you see the state if you want your state, then you want to see what is going on in your local government.
We investigated as UNICEF the consistent low-level coverage of birth registration in Nigeria and found that there are very few birth registrars in healthcare delivery points in the country. So in 2012, we supported birth registration being integrated into the maternal and child health weeks that is supported by the National Council of Health. This kind of has opened up a lot of opportunities to register massive number of especially under 1 children across the health centers in the country, to the extent that there's been a giant leap in the number of under 1 that were registered in 2011 compared with 2013 and now 2014. We keep on seeing the progress, we're monitoring the progress. And for under 5, we also are working with the National Council of Education to integrate birth registration activities into the basic education sector in Nigeria.
There are insufficient registrars to register children, especially at the health centers. So we were able to work with the National Council of Health to integrate birth registration activities into the maternal and child health clinics. So twice a year, the country, all over the country, runs the maternal and child health weeks. So this is one of the centers of the maternal and child health weeks, and we've been able to integrate birth registration activities into the package of services that are rendered to mothers and children in these health centers.
With the maternal and child health now, you see the mothers are coming down. We said we have materials now, the birth certificate are available. We register them and we issue them instantly. We don't ask them to go and come back for the birth certificate. Because of the integration now, we have been on 1 week, we keep informing them that this week of maternal and child health, we have everything for them, including the birth certificate is available.
Birth registration is proof of identity. It is a fundamental right of a baby. Benefits of birth registration includes the following. 1. Right to belong to Nigeria as a country of origin. 2. Right to resources of Nigeria, e.g. registration to start school, health services, social amenities, e.g. electricity, water, good roads, as it helps the government to plan well. 3rd, right of participation in government matters, e.g. elections, government appointments and employment.
Yeah, the National Agency, NAPTIP, works with children, victims of human trafficking, and then many of them, when we ask them about their birth certificate, many of them don't have any idea about it. And then with the introduction of having a central data system or having a common data where the information about their birth is captured, will go a long way in helping us, because the agency deals with children who are below 18 years, so that when they come and then many of them assume the age they are not, falling back on the data already in the data bank about what their ages are, we'll be able to know exactly what their ages are, then know whether we're really working within our mandate or not. And at the same time also, it will help us in monitoring children about their movement, so that when they come, their names are already there in the data system, and then we'll be able to know when a victim has come repeatedly or been circled by their traffickers, and then it will also help the agency in its preventive measures, the issue of having the biometrics will then help us to move a step further to confirm their names, even when they come with such different names, because the data is already captured in the biometrics, and that is a data you cannot alter.
I believe that going forward, the electronic database is so important, especially for registration of birth. Then, if births are registered electronically, then we'll be able to link up with other databases of immigration, party, National Identity Management Commission, and also that of the police. So it's easy to trace and identify someone. For now, it's very helpful because we don't have to now start spending maybe weeks trying to discover the real identity of a victim. And also, anywhere victims appear, they can easily be traced and know who they are. So I think that's where we should be going. We should be going in the next year or so, to be able to bring this linkage of all these databases, so we can have a proper identification of victims of trafficking.
In terms of Nigeria, the best way we can strengthen the right of the child is to give an individual an identity. And this identity cannot succeed until all agencies work together in a unified form. And this form must be digital, must be verifiable, and must be accepted. That's why we have increased the demand by collaborating with National Population Commission that if you need a passport, you must give a document from National Population Commission. I think it's a good practice others can copy.
I went to the passport office to get passport for my children, 3 of them. One is 15, the other is 13, and the other is 7. When I got there, they refused issuing the passport. They said that I have to get a birth certificate for my children. Already I had a birth certificate for my children, but from private hospitals. So they told me the birth certificate from private hospitals are not recognized at all. That I need to go to National Population Commission and get their birth certificates. If not, I'll not be issued with their passport. So that was what I did. I went to MPC office, I registered them, and I was issued with National Population Commission birth certificate. I took them back to the certificates back to the passport office, and I was given my children's passport.
We're about to drive from Kampala, 10 hours drive to the northeast of the country, to the Moroto district, to see how the use of technology is enhancing equity in terms of birth registration. We're going to go to rural communities, hard to reach children, to see how the UNICEF European Union project is really helping those communities.
Yeah, welcome to Karamoja region. Right now we are just bordering Tesoland with Karamoja. So normally rain seasons, the roads are really bad. But lucky enough right now they're trying to put maram on the roads. So now they're becoming a bit better.
So we're now in the Karamoja region in northeastern Uganda, and this is known as one of the most undeveloped regions in the country. So 40% of the population require food aid. That's actually an improvement because it was 70%. So you might think, why in that context is birth registration even on the agenda? Why would that be important when people don't even have enough to eat? Well, there's 3 important reasons for that. So firstly, civil registration is really crucial for a government to know how to account to its population. So when you're delivering food aid, if you don't know how many people have been born, how many people have died, you cannot be accountable to that population and provide them with services. And second and thirdly, at the individual level, birth registration both enhances rights, so it allows, for example, things like access to education. So in Uganda, you need a birth certificate in order to sit exams, for example. And it's also protective. So, for example, it can help protect against child marriage, against human trafficking, things like that.
This is the worst stretch as we are heading to Ilili because the place is flat. Water comes from nowhere. So once you're unlucky and you get maybe trucks passing each other and the trucks get stuck on the way, You're also finished. This place is called the Lily, a trading center for the Kamajongs. It's now a busy day as it's a market day.
My name is Harriet Kajiri. I work with UNICEF as a child protection officer. My focus is mainly birth registration. We are here today at Matanye Hospital, which is in the Park District, which is one of the really hard districts to reach, considering that registration happens centrally in Kampala most times.
Birth registration has come a long way too far. From the time we started, it was really a very big challenge. But bit by bit, working as a team, we have made it so easy and simple. Here are my two colleagues, Damian Amey, who is the records assistant at the hospital, Jonathan Olupot, who is also a records assistant at the hospital, and I'm the IT officer of the hospital. On a daily basis, either of us goes to the ward, mainly maternity ward, to meet the mothers who provide us with the information regarding their kids. So the registration is done to the books as the mother speaks out the information of the child, of herself, the mother, and then of the father. After this information is captured in the registration books, this information is either taken to the records office or the IT office, where registration is done online, up to the point of printing and issuing the cards. So all this particular process of registering birth is done in one day. I was just talking with the mother since she just delivered this morning and trying to take her through the sensitization process about the birth certificates. When these mothers report to the hospital or when they come to the hospital, they already come with this information that these birth certificates are important for their kids in terms of, for example, joining school, and in terms of age, easily explaining the age of the kids. Because for long this has been an issue in, let me say, in Karamoja. Even up to now, you could go and ask a grown-up person how old the person is, but definitely the person will not tell you the right age, because there's never been any documentation about the age of a person. But then believe me, this birth certificate, since the dates of birth of their kids are recorded, they're able to know, or any other person, although they are not able to read and write, can be able to tell them the age of their kids.
So we're now driving in Ongongoja, which is a very remote area of Katakwi, and the roads really are incredibly difficult. So these are much harder than the ones that we were driving in Karamoja.
Yeah, she has a boy of Kardi, a boy of 12 years old. Due to poverty levels here, we have problems of education for getting scholastic materials. We got a chance of child fund, which one is to sponsor children of age 12 below. She happened to get a boy of the same age, but project wanted basically a proof to show that that one is of that age. She lacked a certificate so that the boy can be registered. She came to the office looking for the certificate, but it was too late.
First and foremost, I want to thank European Union and UNICEF for having given Ongongoja this very great opportunity. The people of Ongongoja have got registered and have got these cards or short birth certificates free. Now we have distributed these certificates to our people and they are keeping them so well. You can see some of them are very proud handling them in front here. And they are very, very jovial and grateful to European Union and UNICEF. I want to bring this one forward, that the importance of these short birth certificates in this area, especially where people are returning after so long in camps, is that it really helps to establish where one person comes from. Wherever such a person can go, it can be identified that he belongs to such and such a place. That's the very, very important thing about this short birth certificates. And I'm actually urging my people to keep these things so well so that they will do them a great service.
The certificates we are giving out are received with a lot of value and interest.
Yeah.
And to that degree, they do not want anything to damage them. Of course, to get one certificate initially, there was a cost attached. Now that they have it, they guard it very well.
Yeah.
That's why you see those pockets of the areas where they sit in security and they have relatives here, they prefer to have them kept with those relatives who are here so that they are safe. Yeah.
So we're now here in northeastern Uganda at the end of our field trip. What strikes me the most really is about what a small investment in terms of funding and capacity building can really achieve in marginalised communities. So we've seen two examples, the hospital in Karamoja. We've also seen the remote community in Katakwi, displaced people now returning to their villages. In both cases, prior to this initiative, 0 births were registered. 1 year on, in both instances, there's 100% coverage. So every member of the population in the village in rural Katakwi has their birth registered, from the smallest child to the oldest adult. And in the hospital, 1,000 babies a year who previously would never have had birth registration, the mother now leaves with a baby and her birth certificate, sometimes on the same day. It's quite incredible. So birth certificates are literally issued that day. So real progress being made and little pockets of inspiration as we scale up this initiative